Hi, I'm Dr. Mark Studin, and today with Secure, I'm going to bring you perhaps which is one of the most important messages I've ever done in my career. And I don't like to talk in hyperbole or be inflammatory, but this is really important stuff because I've driven on too many interstates and I've seen too many anti-chiropractic billboards. I've seen too many patients with misdiagnosis, and we have an opportunity as a profession to take a quantum leap forward. And I'm going to give you three examples of how we're going to do that. And you've got a tremendous responsibility. So I'd like to read something to you that is going to be published in one of our national journals. Actually, the Dynamic Chiropractor is going to be running a series of these articles. And let's go up to the screen and I'll show you what we're going to say. And here's what it is. And I'm just going to look off to the side because I'm breaking a lot of cardinal rules now. I talk about other companies. I'm just going to read. I'm not showing you fancy graphics. I'm not putting my name up here because it's not about me. I'm not putting any of my company stuff. It's not about us. It's not even about Secure. It's about you. It's about your patients in the profession. If a chiropractor misses a critical diagnosis that causes a life-threatening situation and a medical doctor catches it, the story becomes an indictment of the entire profession, splashed on billboards, featured in the New York Times, and spread across social media like wildfire. But when the reverse happens, when a medical doctor misses a critical diagnosis and a chiropractor identifies the pathology, there's barely a whisper. Over my 44 years in practice, I've repeatedly encountered this double standard, including in recent remarks to me by a medical specialist directed at our profession. Yet the reality is, through contemporary chiropractic doctoral and advanced postgraduate training, many doctors of chiropractic have developed diagnostic expertise that meets and in many cases exceeds that of their medical counterparts. Increasingly, this is now playing out on a global scale as more DCs commit to clinical excellence. The result has been a meaningful rise in collaborative care with one undeniable beneficiary, the patient. Today, academic joint partnerships, and this is the only one of a kind that exists, such as those between Cleveland University, Kansas City Chiropractic and Health Sciences, and the State University of New York at Buffalo School of Medicine and Biomedical Sciences Office of Continuing Medical Education, are expanding access to advanced credentialed graduate education for chiropractors. They've opened their doors. These are opportunities once largely limited to only MDs. Chiropractors are globally taking full advantage, and while this training often increases utilization within the clinic practice, it does, by the way, practices get better. The true impact is measured in the improved outcomes and better informed patient care. To highlight why advanced training is no longer optional for chiropractors, consider three cases in which MD specialists failed to consider the complete clinical picture and compartmentalize their finding to the patient's detriment. Let me share with you the first. The first is a patient came, and this was actually my patient. Patient came, they went to 5 MDs. They went to their family doctor, aborted family medicine provider practitioner 4 times. Headaches. He was post-COVID. His smell was pretty much gone, but he was getting terrible headaches, and cognitively he was just not functioning. But the key here was he was also his personality changed tremendously. He was a high-level corporate lawyer from one of the largest firms in New York City, and he just couldn't function. So the doctor was treating him for headaches, the smell. He said, "Oh, it's COVID." Cognitively sent him to a psychologist, and he worked with a psychologist for 4 or 5 months. Then he went to a functional medicine specialist. The functional medicine specialist was a medical doctor boarded in internal medicine, hematology, oncology, and ER. He had 4 boards. Smart guy. Did every blood test in the world. Same set of clinical facts, same set of history. And he told him his problem is he was overweight. He had to lose weight. He couldn't find anything. Then he went to a psychiatrist, 2 psychiatrists actually, I believe, who put him on mood drugs because he was all of these issues, and had him start on all of this stuff to calm him down because he was having outbursts. It was just terrible. He then spoke to another world-class, and that's true because the guy travels and lectures all over the world, hematologist from a teaching university out in California. And he worked with him, and he said, you need to be in a long haul COVID program in New York City, because he's from New York, and tried to get him in that program. That was another 4-month wait. So he came to me pretty much for headaches. And I said, who did imaging on you? Nobody. I said, are you insane? No one did imaging? I ordered an MRI. Okay, I ordered the MRI. And by the way, I wasn't in his plan. I have a relationship collaboratively with the neurosurgeon. And I said, you're ordering an MRI, for a brain MRI. I don't care what you do. He said, okay, I trust your clinical judgment. That was case number one. Case number two, and I'll conclude case number one in a minute. Case number two, a doctor in North Carolina who is a fellow in primary spine care. I've trained him, MRI qualified. I've trained him. He knows what he's doing. Looked at the lumbar MRI and it said normal. There was a little smudge of stuff there. He said it was a called a pulse artifact, an artifact, and that was it. That was case number two. Case number three was a doctor in Georgia. Patient came and it was a family member, and he wanted him just to adjust him because he's been treating for 4 years with a physical therapist. In California, there's direct access for limited care for PT. He's had back pain persistently for 4 years that didn't go away. And the chiropractor refused to treat him. He said, just can you adjust me? I know chiropractic works. My back's killing me. I can't get to my, can you do something? And the chiropractor said, no, I'm not adjusting you without an examination, without an examination. He says, the amount of back pain you have, he touched his back. It was very uncomfortable. He said, I'm not touching you. I do need to do a complete exam, and I do x-rays. I ain't touching you. So those are your three clinical setups. Let's show you case number one. Here it is. You see this? This is a massive brain tumor on my patient. It covered, and that's only one view. If you have the opposing view, it covered 25% of the cranial vault. It destroyed his olfactory nerve. He was within days away of going blind, according to the neurosurgeon. He had immediate surgery 3 days later. We sent him to a specialty program in New York University Langone. It's one of the best in the world, with a frontal lobe surgical specialist. He had surgery. He had a CSF leak the next day, which is not uncommon. He had a second surgery the second day. 4 years later, he's alive. He's happy. He's functioning. He's on the soccer field, the football field, the baseball field, the lacrosse field with his kids. He's happily married. He's back to work. Only because a chiropractor decided to look at him as a whole and not compartmentalize him like medicine did. But if I missed this and the medical doctor saw it, he would have died. The MD said he had maybe 3-4 more months to live. It was compressing the cerebral hemisphere so hard that he'd be a goner. It was, but if I missed it, it would have been all over the New York Times. That's not fair. The second one, this was the artifact that the radiologist reported, and the chiropractor said no. This is called an ependymoma. That is a primary malignant lesion on a 36-year-old woman. And we got him right to Duke University Neurosurgical instantly. He saved her life. And we spoke to the radiologist, the general radiologist, which you never want. You want a neuroradiologist, brain and spine, who said, oh, and he was arrogant. You want me to look at it again? You're a chiropractor. Are you crazy? And he says, oh, I saw that as an artifact. The bottom line is not only did the chiropractor save the patient's life, but save this doctor's license most probably. And he was arrogant and nasty. Oh, well, you know what? I'll do you a favor. I'll order a follow-up with contrast so the patient could do that without insurance issues, just to make you happy. He missed, and he knew he missed the tumor, but he was arrogant and nasty, and we didn't care. This saved the patient's life. If the chiropractor missed this and got sued, guess what? He would have potentially, been involved in a malpractice case. At the end of the day, the radiologist would have went down, but the chiropractor could have had some culpability. But at the end of the day, the patient would be dead. That's the bottom line. Last, the patient came in to the chiropractor's house, wanted him to adjust him, 4 years of physical therapy. This is advanced multiple myeloma. This isn't the exact patient. This is the patient. I don't have permission, so I just gave you samples of what it looks like. But this is multiple myeloma. He said when he touched the patient, I'm not touching you without an x-ray. Why? My PT just takes care of me. Yeah, I'm not a PT, I'm a doctor. I'm taking an x-ray. He took the x-rays. He saw this. You don't know what it is from this. He sent them back home. He was in Georgia. He was a family member from California with a prescription with the appropriate sequence protocols. He had the MRI. They saw the same thing, but a little more advanced. Ordered a PET scan to conclude multiple myeloma. He's going to live. He's going to live. Can you imagine if the chiropractor adjusted him? The physical therapist, if they got sued, a licensure board would have to get off the hook. He's only a PT, but you're a doctor. These are 3 lives saved because a chiropractor decided to get advanced training in their craft, in learning how to look at a normal versus abnormal MRI. The chiropractor from North Carolina is not a DAC bar. He's not a radiologist. He knew when he saw this because he just took a course that we had on tumors. He said, this isn't right. He called me up. And I jumped onto his computer. I looked at it. I said, holy crap, it looks like an ependymoma. I'm going to call a neuroradiologist and let him jump on with us and confirm the diagnosis. That's how it works. But now we have multiple teams of collaborative doctors, orthos, neuros, neurosurgeons, pain management doctors saying, my God, these chiropractors can diagnose as well as we can. I'm going to refer to that chiropractor. And the other 2 chiropractors I work with, their practices are exploding because their number one referrals are, the guy who did this, his number one referral is an orthopedic extremity guy. Every time he gets a shoulder problem, he says, you go to the chiropractor, the guy's the best diagnostician I know. I have to make sure you don't have a radicular component before I operate on your shoulder. He refers a dozen cases a month to him. Easy. I mean, that's how this works. You win through clinical excellence. You want to become clinical excellent, you call me. You'll find my number somewhere. You know my name, okay? You find me. If you're interested, you want to talk to me, talk to me. But this is the level we as a profession have to play with. Medicine sees 99% of the population. Our profession, it was published somewhere that says we see 14%. That's a lie. It's much less than that. It's probably closer to 7. We should all have closed practices. Our schools should be exploding, bulging from the gills, exploding, making more and more schools. We need to play at a different level. And it's fun to learn this stuff. You're no longer guessing. Listen, this is perhaps the most important message I could share with you ever. I'm not in the business of just clearing out biomechanical lesions, subluxations, helping pain. I do that. Yes, that's our bread and butter. That's our core. But this is also our responsibility to get to these people and triage accordingly as early as possible. This is called saving lives, and you have that power in your hands. We're ordering MRIs and X-rays all day long. You need to be the best of the best at what you do, or go do something else. Listen, again, I'd like to thank ChiroSecure for the time to share all this information. I can't think of a better message to give. If you want to chat with me, you'll find me. I'm all over the internet. I'm all over every place. Call me anytime you want, and I'm happy to talk to you. Thank you. We'll see you next time.